So far, at least one person has died in South Carolina from the flu. The latest report from DHEC showing widespread activity, which means you should seriously consider getting your shot if you haven't already. Joining us with more is Chris Williams, Program Manager for and Vaccine Navigator for Palmetto Project. Thanks so much for coming here. And there are still a lot of people who have not yet gotten their flu shot, and as we know, it can be deadly. But I didn't realize at this stage in the season how widespread it actually is.
Yes. This is the best time for people to get their flu vaccine, now until next month, peak times. And then after that, it's just going to get worse.
It is going to get worse. And are we seeing a result of the flu shot? Is it preventing people from getting sick as we hoped that it would when the vaccine was actually made?
Getting those vaccines, it helps people avoid some of those more serious side effects of getting the actual virus. And it also prevents those mutations in people from spreading a new strain of the virus, ideally. So that's big reasons to get vaccinated for sure.
And that's exactly what we're seeing with COVID. I mean, we've seen one variant after the other.
Exactly.
And just recently, though, I have had a handful of friends who have all said that they caught COVID. So some of them for the first time, some of them this is not their first rodeo. Are we seeing that resurgence coming up here in South Carolina?
We are, yes, and that's just nationwide too. It's unfortunate, but it's just a thing that happens with the Omicron and its subvariants. Each new variant happens to be a little bit more, it spreads a little faster, unfortunately. But the side effects, the effects of it are less severe that we're seeing. But again, getting vaccinated, helps out with that. Helps you mitigate some of those more severe side effects.
Yeah, they say that the current COVID vaccine, though, doesn't necessarily protect you from those subvariants. Is that true?
So I've been, doing some research, and we're hoping that it does. I mean, it's better than nothing. You still want to have some barrier of defense, at least. Again, like I said, just to mitigate some of those more serious side effects that could come along from another variant.
Right. And if, I realize that the Palmetto Project, it's all about raising awareness about vaccinations, but, if your prophylactic of choice is wearing a mask, using hand sanitizer, and staying fairly distant from your fellow neighbor, then that's what you need to do. So the Palmetto Project, though, you go out into the community and you spread the word.
Yes.
And are you vaccinating people on site? How does that work?
So we don't actually set up vaccine clinics ourselves. We try to support organizations that are doing that already. So we'll go to church events. Again, one of our partners, Palmetto CAP, they're very good at setting those events up, and we just like to spread the word. And we'll go out there. We have informational giveaways for people to access. That's entirely free. We'll also drop those off at organizations.
Yeah.
And we don't, like I said, we don't actually set up those events ourselves. We will go to them, we will support, we will get the word out about those.
And when you confront people, and maybe confront is a strong word, but when you meet people at these events, do you ever get that, I didn't know that before, reaction from people?
Yes.
Do you?
Yes,
and what in particular would you say that you get that reaction from?
Just letting people know that they can get their flu vaccine and their COVID vaccine at the same time. Some people think oh, you can't mix them. It's like, no, you can totally mix them. It's fine. It's better if you do, just to get one after the other so you don't have to think about or worry about the other one.
And then once you do get those vaccinations, how long should they last?
So, the new literature is saying that, 2 months roughly, hopefully longer with more vaccines. It's been different, there's information changing all the time, but it should protect you for at least 2 months until we get another thing going.
And I've never really heard anyone talk about, well, I got my flu vaccination in October, November, and I got another one in February, March. Does that happen? Is that common, or it's more one and done for most people?
I think for a lot of people, sometimes it's one and done, and sometimes it takes a little bit for them to want to get another vaccine. Sometimes they wait and see okay, what are the side effects? Let me wait and see if somebody else got it and what happens. And of course, there's usually nothing bad going on. And
it's also important to make sure that you talk to your doctor before you get the flu vaccination, because actually some of the flu shots are incubated in egg, and if you're allergic to egg, you get very sick.
Exactly. That's one of our new messagings too, is if you want to get vaccinated, please talk to your primary healthcare provider about what's best for you.
Right, absolutely. Well, I want to thank you so much for joining us.
Yes, thank
really
you so much for
great information.
having me.
Appreciate that. We're back after this.